what are the kinds of things we should be looking for? So you mentioned energy and libido. Are in terms of like response and dosing and things like that. I mean, we don't need to go through specific doses, but is it similar to estrogen where it's like, let's give you a little more, see how you feel. Let's give you a little more, see how you feel, and then you sort of have a point where like, okay, I don't think any more is going to help, and it's more of a trial and error type thing.
A little bit. I mean, there are some guidelines. So there are basically a couple of different ways that you can do testosterone. Some people will do injections in the pellets. Like I said, I don't do that. The pellets I'm not really that comfortable with. I think they're, poorly regulated, not well studied, can be inconsistent. There is, of course, FDA-approved testosterone for men, so a gel product that you can use. And generally for women, we just start at like a tenth of the dose of men. So not super scientific. It's like a pea-sized amount that they rub into their skin. So that's one way to do it. They probably won't have that covered by their insurance, but because the tube is going to last them so much longer than it would for a man, it's usually one or two tubes in a year. The other way is to use a compounding pharmacy, which, like I said, I'm not a huge fan of compounded bioidentical hormones. I do use compounding pharmacies when I need to, when I can't get something that's commercially available. And I have a few in my area that I feel comfortable with, but it's sort of the same thing. We just start at a low dose and then we kind of build up from there. And I will talk with the pharmacist specifically about how they make that and how we can dose each patient. But really then I'm checking the levels to see, okay, are we getting too high? And then for the effectiveness to see, basically it's always, how do you feel? How do you feel with that? And some people feel great with it. I would say the majority feel great. They have more energy. They have, their sex lives back. But I do have a lot of people too that's just like, whoa, that was too much. I don't want to be on that anymore. So it's always trial and error. You have to see how each person is going to respond to it, just like with anything else.